Welcome to YARKUD International. Today we are going to see the Fundamental Nursing Saudi Prometric Exam question and answer discussion. Let's see one by one. The charge nurse entered the nursing diagnosis risk for ineffective airway clearance related to an inability to swallow on the client care plan. Which nursing intervention is most appropriate for managing the identified problem? Okay, here are the options. Keeping the client supine position, removing all head pillows, performing oral suctioning, and providing the frequent oral hygiene. So, which is the answer here? So, here the key point is charges giving diagnosis what? Risk for ineffective eye clearance related to what? Inability to swallow. Okay. So, here you have to be remember something is obstructing to the airway. That's why inability to swallow. Okay, so for that, what you will do, keeping the client supine position? No, usually for the breathing difficulty patient, you will put the Fowler position, not the supine position. Okay, removing all head pillows? No, that is also wrong. Okay, performing oral suction. Yes, we can do the oral suction so that any secretion, it will come out. So the airway will be clear. So they can able to swallow. Got the point? Providing frequent oral hygiene, it is to prevent the infection, respiratory infection, not about the, it will be prevent the ineffective airway clearance. Okay, you have to get that point. So here the answer is C. Okay, so always remember when you just choosing the answer, you should read the 4 option and you have to select the correct answer. Inability to swallow, so something is obstruction there. So some secretion will be there. So you have to perform oral suctioning to clear the air. Got the point? Okay, this is about the first question. Let's see the next one. Which nursing action is essential prior to the initiation a new prescription for the 500 ml of fat emulsion to infuse at 50 ml per hour? Here the option, ensure that the client does not have diabetes. Option B is determine whether the client has an allergy to the eggs. Add regular insulin to the fat emulsion using aseptic technique and contact the healthcare provider to have a central line inserted for the fat emulsion. These are the options. So you have to know what is fat emulsion. It is used to nutritional support to the patient, okay, who are unable to get enough fat in their diet. So we will be just giving through the fat emulsion. Okay. Usually for the patient will be getting the normal body function because of the fat substances are not there. So normal body function inhibit. So for this patient, we will give the fat emulsion. Got the point? So in this, you have to be remember, they are asking what is the prior to check. Okay. Before starting this fat emulsion, what you have to check before? So you have to know some of the contraindication of fat emulsion. Then only you can be able to check whether we can give or not. Okay. So if it is the patient having allergy to egg, fish, or the patient will be having bleeding disorder or severe hyperlipidemia. Okay, that means high triglyceride or fat will be high. So this kind of patient, okay, severe lipid metabolic disorder. Okay, so metabolism disorder will be cannot be observed the fat. So lipid metabolic disorder, it is severe cases. We should not give the fat emulsion. Got the point? So allergy to egg or fish, any bleeding disorders, and the high cholesterol, high lipidemia, and there is hyperlipidemia and the lipid metabolism disorder patient cannot take the contraindication for the fat emulsion. So here now you can easily find out the answer. What is the answer here now? So determine whether the client has an allergy to eggs. So that should be checked, not about the diabetic. We should give regular insulin, not that on come. Okay. So we have to be checked, determine whether the client has an egg allergy. So if the egg allergy is there, we should be not start, we should be informed to the doctor. Got the point? Okay, let's see the next question. Mr. Hagamat had just been admitted to your floor with onset of disturbed behavior due to unknown cause. He is prescribed haloperidol 2.5 mg intramuscular now. The pharmacy dispenses haloperidol for injection in the form of 5 mg per ml. How much medication do you draw up to give to Mr. Ahmed? Okay, this is a simple drug calculation. Okay, so here the what we want, we know the formula, right? We know the formula, it is very easy. What we want by what we have, but number of ml per syringe, okay, division. So we will be checking. So here very easy because the order is 2.5 mg. Available form 5 mg per ml. 1 ml contains 5 mg. So what about the 2.5 mg? It is off. Okay. So 0.5 ml in the syringe you will take. Okay. Some questions are very easy. Otherwise, you can use the calculator also, and they will be providing the paper with the pen also. You can do the calculation very easily. Okay, so here the answer is 0.5 ml. Very easy question. Okay, let's see the next one. A client receiving total parenteral nutrition exhibits symptom of congestive heart failure and pulmonary edema. Which complication of TPN is the client most likely experience? What is TPN? It is total parenteral nutrition. So we have seen already the complication previous questions. Okay, heart failure, pulmonary edema. We have to check for the crackle sound in the lungs. Why for that? To what is the complication here? Calcium imbalance or fluid volume deficit, fluid volume overload or potassium imbalance? Which one? Fluid volume overload will cause the congestive heart failure and pulmonary edema. There is a fluid will be stagnated to the lungs. There is a crackle sound in the lungs will be happen. Signs of symptom. Okay. So here there is a fluid volume overload will cause the congestive heart failure and pulmonary edema. The answer is C. Let's see the next one. You suspect the head and neck injury in the victim who is unresponsive and not breathing. How would you open the airway to give breath? Okay, so here neck injury is the key point, head and neck injury. So here are the options. As we know, for the normal patient, head tilt, chin lift. Okay, that is the manner we will use head tilt, chin lift to open the airway. But the patient is having the neck injury or cervical injury. Sometimes they will give you not neck injury, cervical injury. Okay, fall from height. So unable to move the head. So what will be the technique we will use? Jaw thrust techniques. As we know, jaw thrust technique. Okay, that is very important fundamental question. So you have to be remember any injury in the head or neck or the cervical, you should not move. You should be using the jaw thrust technique to open the airway. Okay. So in the next video, we'll see the more question here. The YARKUD International, we are giving the online training for the all the nursing examination like Prometric, SNB, MOH, DHA, HAD, Omen Pearson View Nursing Examination, OET, and IELTS.